Sir, ano naman itong solidarity trials? How is that different from, I mean, why are we now going through a set of solidarity trials midway into actual vaccine rollout? Can you explain to us what the difference is between these solidarity trials that are going to be done as opposed to the vaccine trials that have already been done by the pharmaceutical manufacturers of the vaccine?
Yeah. Well, first of all, solidarity trial is actually supervised and organized by the World Health Organization, for one. And secondly, it will not cover or include vaccines that are already in use or already almost finished with their clinical phase 3 trials.
So these are
it
new
will only
brands?
cover those vaccines that maybe are about to start phase 3 or just finished phase 2 clinical trials. So that's one. Okay. Number two, they will only include vaccines that have been evaluated thoroughly by the scientific advisory group of WHO. We're very keen clinicians and vaccine scientists who really know about the science of vaccination, and they would have chosen the best vaccine candidates with the highest potential to be used. And number three, which is the most important, these vaccines that will be included in the Solidarity Trial are the vaccines that the WHO thinks will be the most helpful and will be most available to countries, including the low middle income countries, because it will be cheaper, because the price, of course, will be regulated by the WHO, and they will be made available, I think, through the COVAX facility eventually, if the results come out to be positive.
Do you have any idea which vaccines are these? Parang wala na kaming alam na.
Yeah, right. Well, I don't want to preempt. Well, honestly, I don't know. What I know is that they have already chosen, based on our last meeting with the WHO people, headquarters, they
Okay, would
already
you know which country is the source? Would you know? Like India, for example?
No. No mention of that. They just mentioned that they have already chosen the vaccine. And if I may be allowed to say that the reason why they're doing that is because they don't want to preempt the announcement of the WHO and hopefully the announcement of countries such as the Philippines, because I think what we plan to do is a joint announcement of WHO and the participating countries, which are, of course, initially the Philippines.
But if you can't name them, ilan po to? Ilang bakuna po ang kasama dito sa trial?
What I'm sure of is, as far as the Philippines is concerned, we'll be testing at least 2 vaccines.
Okay.
Oh. 2 vaccines, and how many are involved? Would you have any idea how many in the Philippines?
Yes, of course we have, because we budgeted for that.
Yes,
we are targeting 15,000 volunteers to be vaccinated. Well, but remember that we are the country starting the trial, but in a matter of 2 or 3 weeks, the other countries will follow. So the contribution of patients will actually be more as the trial progresses. So hopefully by the time that the other countries come on board, we will be trying the second vaccine.
Okay.
And when will these vaccines be available? I mean, given your calendar now or your timetable, and will they be better than the ones we have now? I'm just wondering if there's going to be an improvement of the current vaccines.
What I can tell you is that it's going to be fast because it's a global trial. So many countries will be participating, although the Philippines will be the first, together with Colombia. And we'll be doing it first, but there will be more countries involved. So in 2 to 3 months, that's the target of the WHO and our target as well, that we'll be able to say this vaccine is no good, this vaccine is good.
Okay.
The data will be submitted to the FDA and hopefully it gets approved. So it's that fast.